you can say it.
It is 1:05 PM. We will begin this work session of the Lake County Board of County Commissioners. We are having on the agenda today short and long-term goals, starting with DHS and CDPHE,
PH, public health.
Public Health. Sorry, I forget all the,
Acronyms.
yes, sorry.
Would you like?
Oh, excuse me, you need all that, here, you can do it yourself.
There's a PH in there.
That's right.
Do I need to share the screen
Yeah.
for this recording so I can? Great.
And those dots, you can hide the meeting.
That one?
Yeah.
Great. Alright, hi.
Hi.
Hello.
Great, so kind of how I structured this, I haven't watched anybody else's, but ultimately I'm prepared to give you an update on our short-term goals as we have them published in the 2025 budget book. Then I have some updated goals for 2026 and long-term. Does that sound good?
Yes.
Alright, great. So in 2025, one of our biggest extra credit goals, if you will, was to work on implementing a tobacco retail licensing program within the city of Leadville and Lake County. This is a pretty unique program because public health runs it for both the city and the county, which is different from all other cities and counties in Colorado.
Is the city mandated to have a tobacco program by the state, or is it more of just like?
No, this was more of an opt-in that we wanted to do as part of our tobacco programming to be more impactful with it.
Okay.
In most places that are much bigger, the city will run their own program and then the county runs their own program, but since we're so small, we thought it would make the most sense to just run one program
Yeah.
that we run. And essentially, we worked with city council to adopt all the same regulations that we run for the county program, so that city and county retailers are just all abiding by the same regulations.
Cool.
So we got that passed at the end of December of 2024, and so we've been working really hard this year to implement that, which has overall gone really well, but has been a massive lift, and I think we maybe underestimated it a little bit, which is fine and great. But ultimately, our overarching goal is to reduce minors' access to tobacco products, and we have certainly found that it is not challenging for people under the age of 21 to purchase tobacco in Lake County from our retailers. So I'm really glad that we're doing this program because the results are definitely speaking for themselves, and we're learning a lot about public hearings. But ultimately, we're really excited to start to do the next year of this with all of our lessons learned. I think we'd also like to make some updates in the way that our regulations are written after walking through some of the processes, and wanna just make sure it all really makes sense. And when we're putting big effort into things, it's those really high risk things that have like a big return on the investment in our actions. But that has gone really well, and I'm really proud of our team, very specifically Alana Medeiros, who's now our deputy director. She has done a lot of the heavy lifting on this and has done a fabulous job. And then our other goals on here are really more of just getting back to like our core public health services, which have been a little rocky for a couple of years with a lot of transition. So something that public health agencies have to do every 5 years, statutorily, is do a community health assessment, which then that leads into a community health improvement plan, which guides the work of the public health department for the next 5 years. So when Julia was the director, she ultimately hired a contractor to start that work and process, and then I took that over when she left in May. And we are almost done with our community health assessment. So that's really exciting, and then we'll start working on the public health improvement plan. We've had a really engaged community health advisory panel, which is all of our community leaders from folks doing public health programming in other areas and other organizations health, so that's been great. So not done with that yet, but we'll modify that goal a little bit for 2026. And then our next short-term goal is just to expand access to vaccines, sexual health education, and harm reduction through community outreach, partnerships, and programs. What we've done there is we've really worked hard over the past year to offer more stable walk-in immunization clinics, so that people know, hey, every Wednesday I can walk into public health and get my seasonal immunizations or my kids' routine vaccines, whatever anyone needs, but to have that stability of like, just remember that that happens on Wednesday. Of course, we take people on other days, but trying to get kind of, you know, that routine in there. It had been a bit spotty in the past. Additionally, we're doing more outreach, so setting up clinics where we are like bringing COVID and flu shots to folks. Obviously people do not have to partake in them, but making them available in places where people are at to remove more barriers. And then initially, Julia had written sexual health education in here because we had a goal as we're moving away from doing our Title X program, because Elevated Community Health is taking that over, STI testing, birth control, etc. She wanted to make sure that we were offering that education component. We have started conversations on what it could look like to support that in the school system, but they're just not quite ready for that yet. So we've kind of tabled that a bit, but we have certainly explored it, which I think is a part of this. And then moving into the harm reduction piece of that goal, I am on the Region 5 Opioid Abatement Council and work very closely with Hierarchies Harm Reduction, who's now doing routine monthly services to Lake County. And we've really worked with them to make sure the places where they're offering those services, they're getting good engagement and it's really like meeting that need, and that seems to be going really well. We also run the Harm Reduction Coalition, which I think I'm gonna rebrand to the Substance Use Coalition, but ultimately just making sure that those resources are available for the people who need them in our community, and providing education surrounding that, because most folks don't know what that means immediately or why it matters or how it's beneficial to the whole community. So I think we have made some good strides there and still have a lot of work to do, but it's gone well. And then for our blood testing, we have increased our blood testing by over 25%, so we're pushing it. And what's great is we're getting folks who have never been tested before, which is really the goal in this, right? Like it is great to see the same kids over and over and make sure that every year they're not elevated, but we're getting some new families and some new kiddos, and we're starting to find some elevated kids. So it's good to get into those pockets we haven't been in, so we can provide that prevention education and then you know, put our program into use as needed if those kiddos stay elevated.
Awesome.
Any questions before I move on?
I feel like I've heard recently, I'm sorry, this is not gonna be specific, but I feel like I've heard recently about somebody reaching out to us to do our, not our community health assessment, but a similar thing. Where we could be the testers of the guinea pigs of a larger community-wide health. No, you haven't heard of this. Shoot.
Maybe.
Who did
The
I
way
hear?
you're saying it is not connecting.
I know that. I'm watching your face now.
Sorry.
Oh, I'm sorry, it's not, I'm not remembering exactly what it was, but I thought that we were asked to be, or there was potential that we could be a guinea pig for a larger health assessment survey, but I will remember what it is.
Doing elevated,
No,
are they moving in across from TBC?
Their dental clinic
that's
has
their
a dental
dental
clinic.
That's their dental clinic,
Mhm.
okay. Is that it?
Yeah,
that's always been there,
and then their
They just
primary care
rebranded
is,
it?
yeah, in our office.
Okay.
but, yeah. I'm gonna figure out what this was,
Okay.
Cassie, sorry.
I'm thinking of two things that maybe sort of align with that. There's a big grant
Okay.
opportunity coming up on elevating prevention in Colorado, and we're kind of working on collaborating with the nonprofits and seeing who should apply for that, which there's kind of a component of that.
Okay,
And then we're also applying for a chronic disease pilot grant through CDPHE,
Okay.
which has a large data component, but I don't know if that's what you're talking about.
it might have been the first one.
Okay.
Because it's like just in the conversation piece right now,
Yes.
we've not been chosen, we've
Okay,
not
yeah,
been
no
asked,
one's
there's no
officially applied yet,
application,
yeah.
yeah,
But Lake County is called out as a priority
Yes.
county in that.
awesome, so you're at the table of like discussing who could actually do that,
Yeah.
that's great. Can't wait to hear about that when it actually becomes a thing.
Yes, it will be becoming a thing very soon, the application's due on November 3rd.
Okay, yes,
So,
real soon.
yeah, it's like,
Yeah, we will be hearing about it real soon.
oh yes.
Are there inclinations, are there ways we can help you? It just seems,
We're having, so the group, which is like nonprofit leaders, school district, anybody who's in that prevention realm.
Yeah.
On Wednesday, we are meeting about that to determine how as a community, we think we should move forward with that application
Okay.
collaboratively and who should be the lead and what that could look like.
okay,
So we had a meeting on Friday, and then everybody kind of took away some homework of like, bring to the table what we all think is the best idea, and then we will all get behind one idea.
and specifically around prevention, what kind of prevention?
Substance use prevention.
Okay, cool, yeah, great.
Okay. So next is 2026 short-term goals. So I already mentioned this a little bit, but taking lessons learned from our first year of tobacco retail licensing and work with you all and city council to make any recommended amendments to that for just smoother processes and making sure that when we are putting a big effort in, like I said, it's something that's like a really heavy hitting initiative. The way it's written, some of these smaller things, like making sure all cigarettes and tobacco products have their prices on them, they are important. But if someone's in violation of that, we don't really think they need to be brought to a public hearing.
Yeah,
So just kind of finding a little bit more balance in there.
cool,
And then seeking out new funding opportunities to support current programming and supplement cuts that have come from our state and federal funding streams and will likely come again in the future. We're already working on some of that, so that's good, and I think not knowing what's coming down the pipe, but feeling nervous and anxious about it, we wanna try and be proactive in that way.
have you written a budget that is proactive in that way?
But
Have you written a budget that is proactive in that way, or are you assuming certain federal cuts in your budget, like how are you managing that?
the budget as it is right now does not assume. Yeah,
Any
it
cuts?
has taken into the cuts that have already occurred.
Okay.
Yes,
But no
um,
anticipated?
but I don't know how to forecast.
No, of course not.
Yeah, so it does not. I did not put in the current budget for 2026 any grants that we have not received yet.
Okay,
So
yeah,
assuming we don't get any more funding cuts, I hope until further down the line,
Yeah.
our situation could improve because we do have some applications out there for funding
okay,
that would support programming that is statutorily required that is ultimately underfunded, like chronic disease
Yeah.
prevention.
yeah, okay, thanks.
Yeah. And then, just to measure the work we're already doing, renew the contract with Jeff Stoll and continue the work, on our Community Health Advisory Council and completing the Public Health Improvement Plan in 2026. And then ultimately continuing to expand and promote access to all of the programs that we already have, or if a partner organization hosts a program, making sure we're promoting access to that care and getting those care connections continued to talk about and known about. There's just a lot of gaps in knowledge of what exists in our community, so we try to help be the connector in those areas. And then we wanna continue to increase blood testing, since we had such a large success this year, I didn't wanna give us like a massive number to try and increase it by and just keep it consistent by like another 5% increase, so we'll see where that goes. Any questions on these or thoughts?
Just how much do you, in your promotion of all the services that are available through partners and through public health, like how do you actually access people? Are you going to primary care doctors or sending information to primary care doctors, or like how do you determine how to access so many of our community?
Sure, I think we go to a lot of outreach events
Yeah.
and we talk about a lot of our community partners and bring their resources and bilingual pamphlets and whatever we have
Yeah,
to kind of be like that trusted safety net of like, here, we trust them, we can
yeah,
also go. And then sharing an office with Elevated community health has been a great connection point, especially as we transfer our family planning patients over to them, it's a good connection there. But otherwise, I think we're out in the community a lot and we're talking about it a lot.
I see you guys all the time, I'm just wondering, other than where I see you, are there certain connection points where you're like, oh yeah, we catch kids with blood lead at their pediatrician, you know, or like, oh yeah, we catch kids who are coming in for their HPV vaccines for prevention or STIs or whatever, just wondering.
Yeah, well, something we've done a lot in the past, which is a gap right now, is all the families who come in to see WIC,
Yes,
they're like,
wait,
hey, have these kiddos been tested for their blood lead? Yeah, like
Right.
it's time to start, and
Yeah.
so, Lake County hasn't had a WIC provider in almost a year,
mhm.
but
UConn, put it on
UConn.
the list, UConn, why not?
why not? Great question. Their provider left and they have not hired another in-person person to come to Lake County, so they have only been doing virtual visits since January.
Rude,
So another
rude.
area where,
It also for Chaffey County, so Chaffey and Lake, and we have been, the public health director from Chaffey and I have been meeting with their WIC coordinator, whose name is Jay.
Uh-huh.
And she is delightful, she is super overworked and
Yeah.
I think is doing the absolute best she can and doing a great job. And we're still not quite there yet.
Okay. We were just talking about it this morning, that's why it's good to take a moment so Amy
Yeah.
can write it down, cause we were just talking about like, what is the point, like, not what is the point of UOCOG, we get the mission, but like, are they actually providing the service that we're paying them to do? And the answer is no,
And in this
Nick.
regard, there's
that was
a lot.
no, right?
Correct. I wanna support them and I know that it's challenging with the amount of money they have
Yeah.
to make WIC happen here, but our community needs that
Yeah.
resource. And virtual works for some people, it absolutely does not work for everyone.
Yeah. We already are so under-resourced for our prenatal and infant care.
Yes. Yeah.
What are, just since we're here, sorry,
No, this is great.
can you give us anything else that Andy could bring back to the UCOG? Like, how are we or how are we not getting what we need from them?
Yeah, which their mission statement covers all pretty broad
Yeah.
thing, from housing to senior services,
Mm-hmm.
and WIC seems to be a big one.
Yeah.
But like, what else would, basically what I need to ask them is, you know, in my brain, it's like, is there receipts for anything you guys are doing for us, but give me a report. Like,
I think is a good question.
okay,
And like how much money is allocated to Lake County and how is it currently being spent to support Lake County?
Yeah.
I think that's I have that question also. We also pay out of our senior center budget a lot of fees to the UCOG and I do not know what they're for. They have not been able to give a broken down invoice,
excellent.
they go up every year, they worth almost $13,000 last year. What are they?
Yeah,
It comes out of the senior center and I'm like, how much do I budget for? I don't know.
yeah.
Would Rochelle know what the, numbers the senior center is paying UCOG? Like, I'd be like, hey,
She said $13,000, right?
oh, you did?
Cause the
Those
senior
fees,
center's
yeah.
under public health.
Okay,
We'll talk about them next.
Okay.
But yeah, and then they're based out of
Rochelle, we
obviously
were just talking
Rochelle.
about you, babe.
Hi.
hello.
You're
Yeah,
not,
great.
you're early, you're doing great. Yeah, and a lot of their programs are not available to Lake County residents. Like they support transportation in Fremont County, but they don't support transportation in Lake County.
Oh man, they are not gonna like me at this meeting, it's gonna be awesome.
Yeah.
And they
You
don't
okay?
like me
Okay,
either,
Let's
you know how I
go.
should support.
yeah, I mean, there's still so much that I'm learning, but this is one that has kind of been like, what are we doing here? All I hear from you guys is like, well, we've been in a really rough place and we're finally getting everything back together, and then it's like, okay, see you later, I'm quitting, here's this person who's replacing me. And that person comes in and they're like, well, we've been in a really rough place, but we're finally getting to a better spot, and I'm like, not, I feel like Groundhog Day, like nothing is changing in these meetings and I don't even know what we're getting out of you guys. And we're part of this and so, yeah,
Something they do really well that we'll talk about more with the senior center is supporting our nutrition program there.
Mhm.
But other programs in Lake County, I feel a lack of support and care. They don't often come up to meetings that we've scheduled with them, they cancel most of them. And I think there could be a world and where Chaffey County Public Health, a lot of other public healths run the WIC program. And I think there would be bandwidth between Chaffey and Lake County to run a separate WIC program that's not under the UCOG and take the funding directly. That was pretty unpopular when it was voiced
Unpopular with
to
whom?
the UCOG.
But it's hard to.
Because I
Of
believe they use
course.
that, funding to fund their WIC coordinator and they can't probably fund it without having these other counties.
Yeah.
But they're also not serving our community with in-person
Yeah.
support.
Also, weren't they accidentally funding the whole of UOCOG with things that were statutorily supposed to be funded that they weren't funding? Like, didn't they just have a massive budget
For
Oh
what
my
is their
God.
because they were misappropriating?
like borderline or actual criminal issues
Yeah.
going on there, situations.
Heather. Anyways, there's still a lot of room
Thank
for
you.
improvement and I think we have a huge gap with WIC, but those programs and nurse family partnership are other areas to answer your question.
Mhm.
Where we do connect to kiddos that might not be integrated with some of our Lake County
Mhm.
resources, but do live in Lake County.
Okay,
And those are income qualified programs for young families.
thank you.
Yeah. And then long-term goals, ultimately retain our staffing to continue to deliver strong programs. I have spent a lot of time hiring and training people and right now we're in a really good spot, so I wanna keep our staff very happy and the community trusting of our staff and the strong programs that we are delivering across the board. And then we do just wanna keep our minds open for other opportunities for collaboration between the city of things that we could do to promote the health and wellness with people of Lake County if there's other licensing or inspection programs. Our goal is not to become like heavy regulators, but the data-based approach in these programs does support a lot of our public health goals. So just keep an open mind on any other gaps in there, especially as we explore like supporting a large substance use prevention grant in Lake County with other community partners. And then I combined blood goals in here, even though it has a separate budget, but also just continue to collaborate with the Lake County Community Health Program Work Group, which encompasses you all, to just kind of reestablish and implement long-term goals that guide the program's growth and impact. I just wanna make sure that program doesn't stay stagnant just because it's how it's always been delivered or done, and keep the engagement.
Is your blood lab program included in like the community health impact survey? I don't remember the name of it, I'm sorry. The
Community health assessment,
health
not
assessment.
specifically. I would consider that as part of preventative care, like in that bucket, which is, yes, in that, but the blood lab program here, since it's separately funded by that trust, it's not gonna go anywhere. Even,
I meant, is it an add-on or is it already included in what data you're collecting during your community health assessment? Community health assessment, is that
Yeah.
what that maybe?
it is not specifically called out in the community health assessment.
So would you have to separately fund data collection that determines how many kids are in the county, how many of them have had access to blood testing? You know, like, how do you find the gaps in the blood lead program?
That's a good question. I think we can use the data pulled from the community health assessment and
Yeah.
connect it with our blood lead data, but they are collected separately. Cause the blood lead data that we collect is by kiddos that we are seeing and testing.
Right,
And then like the community health assessment is assessing like the population of Lake County and bringing some of like how many kids are in Lake County.
Right, so you could use
So-
the health assessment to
yes.
inform the blood lab program,
Absolutely.
but you're not like, it's not part of the community health assessment.
Yeah, cause that's gonna stay. So the community health assessment is kind of like, what programs does our community not have? Or
Mhm.
what areas do we need to put more effort into?
Mhm.
Because it's a huge need here in our communities telling us
Mhm.
that the blood lab program will stay.
Yeah.
Regardless, so I don't think it's not like being evaluated in that process.
I see what you're talking about, sorry, I was thinking that you would be like, in the community health assessment, you would be tracking like comorbidities and then determining what kind of programs need to be created. Not like, which in our community, one of those things would be blood lead. But you're not actually, you can't include it.
Right.
I get it, it's super confusing, but I
It
get it.
is very confusing, and what you're saying would be really neat if that was easier to put together.
Yeah. Okay. Cool.
Any other questions or thoughts on this before we shift gears to the senior center?
Not for me.
Mm-mm.